I'm Erica McGough, and this is Case Study 17.2 from the Clinical Assessment Workbook by Elizabeth Pomeroy for my Colorado Christian University class Psychopathology. The client, Mrs. Joyner, does not know where she is. She is unaware that she was carrying her own handbag. She does not answer a direct question of where she's trying to get to, and is unaware of her current location. Instead, she asks where her bag is, which she was holding. When asked if she would like something to eat or drink, she does not answer the question directly, but instead answers with her favorite dessert, strawberry shortcake. Given her disturbance in attention and cognition, and because I have no further information at this point, I would consider unspecified delirium as my initial diagnosis and would keep in mind neurocognitive disorder due to Alzheimer's if further diagnostic information on her medical history could be obtained. Question 2. What diagnosis would you give Olivia Joyner at this point? Further information reveals that she does not know her current age, what year it is, or where she is. She does not know how she got to Georgia and has been missing for a total of 6 days, but she is worried about her cat and her baby, whom I assume is her son. She mentions a Carter, but she does not know his whole telephone number. My diagnosis would not change at this point. I still have no medical history, no personal history, and have not clarified how recent her loss of memory and decrease in cognition occurred. I don't know if she's gone missing before or if she typically requires any kind of help at home. Question 3. Other than contacting a family member, are there any other resources you would want to involve at this point? I would want to immediately involve the hospital. As Mrs. Joyner has been missing for 6 days, it is unknown whether she has been eating or drinking properly, even though she appears to be in okay physical health. I also do not know if she is on or needs any daily medications. The hospital would be able to look into this for me and make sure her physical health is okay, as well as check for any mental and bodily trauma from a fall or accident by using CT or MRIs. Based on this interaction, what would you change your diagnosis for Olivia Joyner? If so, what would be your new diagnosis? After talking to Mrs. Joyner's daughter-in-law, it's evident that this recent confusion is quite sudden. Because it's unknown whether her neurocognitive problems are caused from a fall, medication withdrawal, or due to a disease, my diagnosis of unspecified delirium would remain the same. Question 5. What will be your final diagnosis for Olivia Joyner? After learning that Mrs. Joyner has had some sort of brain bleed from a possible stroke, my diagnosis would change to major neurocognitive disorder due to another medical condition. And finally, question 6. List the psychosocial and cultural factors as V or Z codes that would apply to this case. I would apply V60.3, problem related to living alone, since Mrs. Joyner is alone and has no one to corroborate whether she fell, had a stroke, etc. I would also apply V62.89, other problem related to psychosocial circumstances, since Mrs. Joyner is alone and is unable to advocate for herself due to her mental condition. And I would also apply V40.31, wondering associated with a mental disorder, since Mrs. Joyner was missing for 6 whole days. Thank you.